welcome to 72 Dragons. Today we have the pleasure of speaking with Sierra Galvan and Jorge Puentes. Welcome to this interview, Sierra Galvan and Jorge Puentes. It is an honor and a pleasure to have you with us today.
Pleasure to be
here. Thank you for having us.
Sierra Galvan is a public health enthusiast, leveraging experience in research and community engagement to address health disparities. She's active in promoting health education and community involvement. Jorge Puentes is a passionate advocate for public health, dedicating his efforts to addressing health disparities in border regions and promoting health equity. Their work spans many fields, including the film production showcased at the American Public Health Association Annual Meeting 2023 in Atlanta, Georgia, titled Don't Dread Sex Ed. Through this work, they try to normalize the sex education conversation between Hispanic mothers and daughters, promoting awareness and resources through innovative approaches. Their commitment lies in using their expertise to drive meaningful change and empower underserved communities through education, advocacy, and community outreach. My name is Dr. Pietro Aparicio from 72 Dragons Health. Thank you for joining us and for sharing your experiences with us. Without any further ado, let's begin. So you're both finishing your master in public health. I understand that you're graduating tomorrow or this week. So congratulations.
Very exciting weekend.
How did your master in public health influence your approach to addressing health disparities in bordered communities?
So we were the program we selected, the master's program in public health in UTEP, we're very lucky that it has a particular focus on addressing the health inequalities and disparities in the U.S.-Mexico border. So it kind of gets drilled into us from even before beginning the classroom setting that we want to focus on this region. And in classes, it gets reinforced. And even for the thesis component of the track, in order to be approved or successfully defend throughout both the planning, the proposal, and the defense, you have to fulfill certain border competencies. So it kind of always gets drilled. And then from UTEP, the campus is right on the U.S.-Mexico border. Like you go out and you can see Juarez on the state of Chihuahua in Mexico. So it's kind of always like present that we're not academia. Sometimes it's kind of seen as an ivory tower, but we try to change that. We involve in the community. We're also very lucky to be part of Students for Public Health, which it was a student organization. We're both very involved that allowed us to provide back to the community, but also have that involvement that I don't know a lot of programs in academia provide, having the focus and the giving back to the community and being involved. So I think we locked that with our program.
And some of our classes also introduced different concepts and theories that I was previously not aware of. One of those being a systems thinking approach. And I think it did help not only inform this PSA, but also my thesis to look at the different systems that are interconnected that implicate both vulnerable and minority populations and how we can build, whether it be community engagement or policy, to help try and mitigate those health inequalities.
Great, thank you. So in public health, there are many ways to address public health issues, but in this instance, you chose film production. So what made you go in that direction?
So I've had experience since high school having to do PSAs or short films, and I've always loved the communication aspect of providing health education or just awareness. So Jorge and I were able to contribute and create a PSA, and we wanted to specifically target Latina mothers and their daughters in regards to sex education and conversations that are typically stigmatized or regarded as taboo. So we wanted to make it more of we wanted to use more levity and humor to kind of address these topics that are not so talked about in this culture.
Yes, and we wanted to make it relatable, right? We wanted to, again, taking kind of a comedic approach to it, kind of setting a lighthearted tone, so that the individual will be more receptive to it be engaging with the material. And also, if it's levity, like, if it's even like we try to include a couple of relatable experiences, primarily from at one point in the video is like the mother talking like, did my mother talk to me about sex education? So kind of make it relatable, and it make the mother be able to see herself in this environment. And if you're able to make that connection with the audience, they're more likely to engage afterwards with, we have at the end of the PSA, we have a QR code with both layman sources and then more academic sources. So one's like, I'll check it out, right? Like I can relate to this. So we wanted to have that be more receptive to the audience to actually use the resources that we wanted to provide with this PSA.
Interesting. Can you share a little bit about how do you came up with the title Don't Dread Sex Ed?
So when creating the title, this entire concept for the PSA was inspired by my own experiences, especially with the relationship with my mom, because when we were brainstorming different topics that we could potentially do the PSA on, I kept getting drawn back to sex ed and the HPV vaccine and teen pregnancy, and I was trying to recall any conversations that I had with my own mother about these topics in regards to any sexual education. And so when I was recounting these feelings and these conversations that my mom and I did or did not have, I remember being a child or a teenager and having that dread of having to bring up these topics. And when I was talking to my own mom, she also had the same feelings of dread. So when I had pitched the title to Jorge, I asked him, how does this sound? Don't dread sex ed. And then and I don't remember exactly how we got the conversation about using the apostrophe. So do you remember, Jorge?
Yeah, we kind of wanted to make it seem like education. So like, don't like reinforce
yes.
part of it.
There we go.
Also, kind of give it a little bit like, so, I mean, we did mention in the beginning, but like, so the title will stand out. Like, why is that apostrophe there? And then, eye-catching, right? A little bit of marketing, which public health needs in general in order to deliver messages. So a little thought off.
A little pizzazz.
Yeah. I thought it was very smart. The first time I saw it, I read it first as Dr. Ed, and then I realized it was dread. So I was like, oh, okay. I actually liked it. Great. Many filmmakers will probably listen to this interview. Can you share a bit about, what was the experience of going through the pre-production process, the production and the post-production of this film? How was that experience for both of you?
So this is definitely something that we had a time limit on. And we tried to finish this as soon as possible so we can also submit it to the APHA Film Festival. We did have to brainstorm ideas. It was a lot of back and forth about the topic at hand and what we should do the PSA on. And then we had to actually outline or storyboard what we were going to do in the PSA. And we had to even scout different locations. And we did end up using UTEP, the University of Texas at El Paso, just because it's convenient, it's accessible to students. We can bring our own props, or we can bring our actors into the location to film. And it did take multiple days to actually film. And some of the ideas we did have for our storyboard had to be revised, or we had to reshoot them. And then in post-production, we had to utilize just different elements, so different like movie Movie Maker and iMovie, and then different post-production programs like Photoshop and Adobe, just to add a little bit more pizzazz and professionalism to the end product. So it was a very fun and also a stressful time, just because we had never worked together and we're both classmates, so we already had more of a friendly relationship. But I think it was ultimately really fun, not only for us, but for the other people involved, just to create a piece of media. And on top of that, to be selected to be featured at the film festival was just a great honor. And I'm really happy that I was able to do this with Jorge.
Yes, I think she's selling herself short during the outline that she provided. We had scripts ready. Sierra did a lot of the carrying in that aspect, and then the shot compositions. I'm a bit of a film buff, so I try to apply like, shots from movies I like. Let's because we shot kind of like guerrilla style. Like, here's the street. Okay, let's find this shot. My favorite, because it was like a fulfilling kind of like activity, filming this PSA and everything, but it was also really fun. Like, I was laying on the floor finding like, no, this shot doesn't really work, but if you do this and this. And my favorite part was right at the end, when the world-class actors that we managed to recruit through a very extensive application process, and by that I mean getting Sierra's mother and my sister to be like, hey, you guys want to be in it. But at the end, after the whole ordeal with the mother, the turmoil of how she's gonna bring this conversation, and they finally have it, and then at the end they're walking into the distance, into the sunset, and that shot, we actually spent like on that shot alone like an hour, if I remember correctly. We couldn't get it right, and then I was like, you know what? Let's take it from the floor. So I got on the floor, took the video, and then we did the little like from the Breakfast Club at the end, the fist, but it's them hugging, and we ended up using that as our not necessarily logo, but like the image that you see once you get into the QR code. However, even though we had a script and everything, a lot of the things was like, let's film this from inside the car, and it was just a very creative endeavor, and I don't think that a lot of creative opportunities are offered, at least in my experiences in academia. So it was kind of seeing this like fun approach, and like this it was my first PSA. I know Sierra, which I was very fortunate to be to work with her in this, and she has previous experience, but having that like a taste for it, because there's so many one-pagers can take you so far, and public comments, but like having like this, especially when trying to engage with the active audience, I think it was a lot of fun. And I cannot state enough how happy it made us to go to the APHA conference based on work we submitted and did. Like, being recognized in this manner was like, oh, that's pretty cool.
Yeah, yes, congratulations that you guys were selected for the film festival. And what has been the response from the audience at APHA or outside APHA? What responses are you getting back?
So we did, before submitting our videos to APHA, we did have a little movie premiere or a PSA premiere at UTEP, where we invited faculty and our families and classmates just to have an opportunity to view the film before we submit, because we didn't know at that point if this is what they were looking for or if we were going to get selected. So we had a lot of feedback, not only from our classmates, but also from our faculty. And one faculty member in particular, Dr. Concha, actually was able to help guide our PSA. She helped us utilize and identify a specific target audience that we can tailor the PSA toward, just so that it's more authentic and it's more relatable for the population that we wanted to serve. Of course, it's really hard to create messaging that's universal So from my past experience, it's more effective to use messaging that targets different subgroups, especially if that's a different cultural or population subgroup, just so that people feel that they can relate to it more and take more from the messaging. So we were able to identify a target audience, and ultimately I think it did help shape our PSA to be as successful as it was. But from APHA, just because it wasn't featured in person, they reserved that time slot more for the featured films, and they're professional filmmakers, and even then we couldn't see their entire work. But I do think that we had a great response from the people that helped create the PSA.
Great. So talking about messaging, using comedy as a tool to approach sensitive topics like sex education, particularly from a mother's perspective, is challenging. So how do you guys went about to make it effective?
I think we kind of touched upon this a little bit earlier. We wanted to create this environment where we kind of wanted to take away some of the stigma associated with primarily in Latina communities, even among when Sierra was talking about tailoring our message, we originally were talking about Latina communities in general, but we tailor it towards acculturated mothers or second generation immigrants, because even among first generation immigrants, it's still a very much a taboo subject, right? Like sex until marriage, condoms don't even mention it, which condoms are like the triggering aspect of our little story that we constructed. So we kind of wanted to disarm them, or not disarm them, but make them feel comfortable with the subject material, and then slowly making sure, like, yes, this issue of having this talk with your daughter is something that most mothers have felt, right? And if you don't have that information, is how do you deliver it? So again, using that comedy to make them feel comfortable. There's a saying, you get more flies with honey than with vinegar, right? So we wanted to create that. And I think, again, like I said, having them, once they feel comfortable with it, once they feel relatable, they can relate to the message, then they can access the materials. Once they access the materials, they can feel more like, okay, I can do this and have this conversation with my daughter.
And I definitely did get feedback, not only from my own mother, but from my aunts, from different stories that I've heard among my friends. And I just tried to understand what the underlying themes were. And it was just even bringing up the conversation of sexual education or just sex ed, knowing that there's still kind of a hesitancy, even among parents, that even despite them knowing that, oh, I do think I should bring up these subject matters, it's still nerve-wracking to do it, because sometimes we don't know how, or we don't know how to initiate conversations, or kids don't know how to ask. So definitely getting feedback and just listening to how my mom remembers trying to initiate these conversations, I was able to use her perspective as the main focus for the video. So usually they try and target children or teenagers to be the ones to bring up these conversations. And in reality, parents should also be having these conversations, even if it is nerve-wracking or even if it does cause anxiety. Because at the end of the day, they're going to learn, and it's good to have that support system in the form of their mothers or parents. So I'm glad that I was able to have my mom as not only an actress, but a resource to use as well.
That's fantastic. Now, coming back to the to border health, as it was mentioned before, what are the primary goals you guys have within the field of public health, especially concerning border health and minority rights advocacy for coming years?
We have, I do want to, even though the work we did was with sexual education, sexual health, my focus career-wise has been primarily focused on substance use, harm reduction, opioid reversals, and policy. So that's also like part of my thesis, part of my actual profession has been with harm reduction and substance use. So it's very good. We live in Texas, so it's a state that has a lot of how political can I get? Because I have chosen comments, but draconian laws in regard to this community. It gets stigmatized, especially during COVID. I personally saw through outreach work and managing a harm reduction program, working with this community, how the opportunities available to the general population were not there. And there's such an intersectionality with substance use, with like homelessness, poverty, access to resources, previous systematization, and negative interaction with healthcare services, to the point that people do not want to engage with further puts them at a risk. And during COVID, they were at higher risk of experiencing harsher symptoms and death than the general population. So what I would like to do, I've done also been part of legislative groups that try to enact policies such as, for example, for fentanyl, there's a fentanyl testing strip. Individuals that are using substances can put it in their material, and they can test if there's fentanyl or no, and then have a more educated situation of what their use is. And it is illegal in Texas. Syringe exchange programs are also illegal in Texas. There's only, I think, in Bexar County in San Antonio is the only pilot program. It is legal, and we have tried to support legislation that expands the pilot program. Unfortunately, they have not been successful in the congressional setting in the last 3 sessions, 2019, 2021, 2023. We are hoping that 2025 is different. I'm part of the El Paso Harm Reduction Alliance, and we've also worked with the Texas Harm Reduction Alliance, and I know it's very high on our priorities to make this a reality. So if I can have this little podium that I can have, it's like a call to action. So it's just, sorry, I feel like I've talked too much already. But yeah, so long story short, continue my PhD and advocating for people who inject drugs and people who use substances.
Great.
And for me, luckily, for my thesis, it does have a correlation to the PSA that we did make. And my thesis focuses on HPV vaccination, especially among the acceptability among mothers and their daughters, as well as just identifying the different factors that implicate their decision to vaccinate their children. So being able to work on a PSA that addresses the underlying issues of sexual education, and then the consequence of either fulfilling this role to their parents' role to their children, I would like to also continue my education and also advocate for just more quality sexual education programs, especially in schools, especially in the state of Texas, just because they're very non-existent. And even as a substitute teacher, I see the different cracks in our foundation, especially at an educational level, that this is something that is needed. This is something that can implicate the health of their children for years to come. And it's something that the children have a right to know in regards to their own health. And it should be taught in schools, and it should be more transparent. So I would also like to continue my PhD and write a dissertation, especially in regards to HPV vaccination. And hopefully my career will lead me down a path of advocacy, not only for Texas, but the entire United States. So.
Great. Thank you for sharing, and we wish you both the best in your future plans. So Sierra Galvan and Jorge Puentes, thank you so much for your dedication to public health and advocacy. It's really inspiring, and you for impacting lives through your very valuable work. Thank you very much.
Thank you for having us.
We're very grateful for this opportunity, and thank you for highlighting us. It's a great honor.
Wonderful. Thank you.